talking with Dr. Grant Bowman. He is with Bronson Sports Medicine Specialist. There's a program coming up tomorrow that we're going to talk about. But first, we're going to talk a little bit about shoulder pain. Does shoulder pain rule your life? Having had shoulder pain before, Dr. Bowman? Yeah, the answer is yes. If it's bad enough, it really can. Welcome. It's nice to have you this morning.
Yeah, good to be here again. Thanks for having me, Jim.
So let me ask you, what are the major causes of shoulder pain?
Well, Jim, there's a lot of different things that can cause pain in your shoulder and around the shoulder, and those actually change as you go through the different stages of life. So in very young people, high school students and the like, they usually have pain because of instability, which is a problem when the shoulder is too loose. And then as we get a little bit older and we get into middle age, and we start to see problems with the soft tissues around the shoulder, things like tendonitis or rotator cuff tears. And then we get a little older, and as we get into the retirees or the elderly population, we see a lot more of degenerative problems, things like shoulder arthritis. So really everybody from teenagers all the way up to the elderly can have problems in their shoulder, and the causes are numerous.
Dr. Bowman, are there ways or things that we can do to delay surgery?
Yeah, in fact, most problems in the shoulder don't really need surgery. Now, different surgeons practice differently, but one of the things I try to do with my patients is help them understand what the diagnosis is, and then we lay out all the different treatment options, and we go over the pros and the cons of each. So some conditions need surgery quickly to make sure that the patient gets better all the way, but for most problems, there's going to be non-surgical options that can work quite well.
Now, are those options for as far as non-surgery go? Can there be a combination of things like drugs, physical therapy, actually just plain old rest?
Yeah, no, absolutely. And in fact, the first step is you got to make the correct diagnosis, because if you don't know what the diagnosis is, then you don't know necessarily what the proper treatment is. But a lot of times that's just listening to a patient's story, doing an exam, and then sometimes we use things like x-rays or MRI to help kind of, solidify the picture in our mind what the problem is. But the things you mentioned are all things we commonly use. Probably physical therapy is the most common one. The vast majority of shoulder problems respond very well to physical therapy, and other times there's a medication or an injection or a brace or something else that can be used. But yeah, there's a lot of options before we take them to the operating room.
We're talking with Dr. Grant Bowman of Bronson Sports Medicine Specialist. All right, so let's talk about this. If surgery is needed, what are some of the options there?
Well, again, it depends on what the diagnosis is. You need to tailor the treatment to what the specific issue is. But, most problems in the shoulder now we can treat with arthroscopy, which is minimally invasive surgery done through just a few very small incisions, a little bit like building a ship in a bottle. The technology's advanced where we can fix just about anything in a very minimally invasive way. Now, on the other hand, when the shoulder is actually worn out or severely arthritic, then sometimes it needs to be replaced. But even for that, there's different kinds of shoulder replacements for different problems.
Dr. Bowman, or I say let's choose that because you happen to mention it. How do patients prepare for shoulder replacement if that's the option that needs to be taken under?
Well, so for patients who are having shoulder replacement at Bronson Methodist Hospital, we actually have a preoperative education class, and it's for the patient and also a coach, which is a family member or a friend. It's any person of their choosing. And the class helps the patients and their coaches to understand what to expect before their surgery, on the day of surgery, and afterwards. And it sort of helps them prepare themselves for the recovery process as well. So this class is taught by one of our orthopedic nurse navigators, who is also available to answer questions that the patient or their family may have before the surgery. And they also help coordinate the care while they're in the hospital after the surgery as well. So really, before, during, and after, we make sure that they're covered.
Dr. Bowman, can you give an example of maybe a patient who had shoulder replacement surgery, what it was like before and then after surgery?
Sure. Well, obviously, for privacy reasons, I can't use names, and I won't. But to give you one example, I had one patient who was a nurse in her early 60s, I think, and she had some injuries and even had some surgeries on both of her shoulders when she was very young. And the end result of that was she got arthritis at a relatively early age in both shoulders. And she had gotten to the point where she was in pretty much constant pain. She had popping and grinding when she was moving her arms, and was beginning to have difficulty with everyday tasks, things like doing her hair and getting dressed. And I remember talking to her about how she felt she was losing her independence. And that's what can happen when you get arthritis. It's not just pain, but you start to lose function, range of motion, strength, those sorts of things. And so she had already tried some medications and some non-surgical treatments and had seen some other doctors before she made her way to my office. So we discussed her options further, and we decided to replace the shoulder. So we did the one that was hurting her the worst first, and after the surgery, she had relatively quick relief of almost all of her pain, to the point that in a few weeks she was asking, when can we do the other side? So we had to wait for her to recover. But less than a year later, she ended up having the other side done. And now she's pain-free in her shoulders, able to do everything that she wants to do. She's independent and just very pleased with the outcome. And that's a pretty typical story for people who have shoulder arthritis and get their joint replaced. So, it's a major surgery and not to be taken lightly, but for these people, it's a life changer.
We mentioned earlier there's a program coming up that's going to address shoulder pain. In fact, it's called Does Shoulder Pain Rule Your Life? Dr. Bowman, tell us a little bit about where that's going to be, when it's going to be, and do you need to register for the program?
So the program is going to be tomorrow, Tuesday, October 18th. It is at 6:30 p.m., and it is at the Bronson Athletic Club, just off the 9th Street exit of I-94 there. We do want people to register, if at all possible. It is a free program, so there's no fee, but we'd like people to register to have an idea of who's coming. And you can do that by going to bronsonhealth.com/classes, or you can call the Bronson Health Answers phone number, which is 341-7723.
And this would be a good time to go and ask all the questions you want, and and maybe take that step and find out more information on what's going on. If someone can't attend tomorrow night, Dr. Bowman, how can they get additional information?
So there's a phone number they can call. That's 855-618-2676, or they can go to bronsonhealth.com/ortho-BMH.
All right. Dr. Grant Bowman with Bronson Sports Medicine Specialist. Tomorrow night, they're going to be out at the Bronson Athletic Club from 6:30 until whenever it's over. Talking about shoulder pain, and if shoulder pain rules your life, is an opportunity for you to come out and talk a little bit. And again, they would prefer you register. Just go to bronsonhealth.com/classes or call 341-7723. Dr. Grant Bowman, thanks for joining us today. We appreciate it very much. Hope you have a standing room only crowd tomorrow.
Yeah, thank you. We gave the talk once before, and it was very well attended and well received, so we thought we'll just do it again and hit some more people with this information. So thanks again for having me, Jim.
All right, thank you. We'll look forward to talking to you again soon, Dr. Bowman. Dr. Grant Bowman with Bronson Sports Medicine Specialist.